This episode focuses on guns and gun safety, and as a content warning, we talk to a survivor of a mass shooting. Welcome to Kids Wellness Matters. I'm Dr. Nina Alfieri.
And I'm Dr. Rob Sanchez. We are both parents and pediatricians at the world-renowned Ann and Robert H. Lurie Children's Hospital of Chicago.
On this show, we'll chat with a wide range of experts about caring for children from newborn to young adult, because kids' wellness matters.
You know, Nina, just the other day, I was talking in clinic with a family about the importance of gun safety. It can be one of those tough things to talk about, but I always feel the need to bring up that, firearms are the number one cause of death for kids in the United States.
It's something that, as a parent, terrifies me because of the finality of a shooting. And guns are a part of culture in a lot of communities. And so being safe with guns is something that is really important to think about.
We're both pediatricians and we know the recommendations from the American Academy of Pediatrics. They talk about keeping guns and ammunition locked away, stored separately, keeping things as safe as possible. And that's really how I really try and approach it, especially with talking in clinic with a family about the importance of gun safety. Because if we can find common ground, it's that we want to keep things as safe as possible, right?
Absolutely. I had a really powerful conversation with a fellow Lurie Children's pediatrician who we're going to hear from today, Dr. Emily Lieberman. She was a survivor of a mass shooting and since that day has become an absolute advocate for gun safety. And she will share some valuable information today that parents can use to keep their kids safe.
I can only imagine. I'm really looking forward to hearing your conversation with Emily about the importance of gun safety and some of the good conversations that come out of it.
Hi, Emily. Thank you so much for joining us today. We're thrilled to have you.
Hi, Nina. Thank you so much for having me and taking time to discuss this very important topic.
Yeah, you and I have known each other for quite some time, and we're similar spirits in that we're both primary care doctors and parents. And, I'm so glad you're here today because this topic is really important to both of us as pediatricians and parents. I'd love to start, if you don't mind, just hearing a little bit about your background and how you got into this position of such strong advocacy for firearm safety.
Yes, let me just start by saying that I am a proud employee of Lurie Children's Hospital. I am a pediatrician at Town and Country Pediatrics. I practice out of the Glenview location and have been there and with the office for over 10 years. It's really important that I describe to you right now everything that has changed in my life in the past year and a half, that you understand that these beliefs are my own. I represent myself as an individual. These are not beliefs of Lurie Children's Hospital. So all the work that I've done has been my own individual work. I used to consider myself an advocate for all things children's health related, where most of the advocacy would take place in the office, informing parents about prevention, injury prevention, how to prevent diseases, accidents, etc. And then on July 4th of 2022, I was involved with my family in a mass shooting. My most favorite holiday of the year has always been July 4th. And even when I didn't have children, I attended the Highland Park 4th of July parade every single year with my entire extended family. And on this particular day, we were extra excited to go to the parade because of COVID. It had been canceled for 2 previous years. At the time of the event, I had a 5-year-old and a 8-year-old. We were all collecting candy in the streets and the kids were running and hanging out with other friends and family members in the community. And all of a sudden there was popping overhead and it was very clear that these were gunshots. Very quickly, everyone started running. My husband grabbed my then 8-year-old daughter from the street. And as I searched for my 5-year-old, he and I lost track of each other in the stampede of people. The only vision in my head was that they were getting shot in the back as I tried to find safety for my 5-year-old and I. I lost my shoes and I did manage to find my mom and stepdad and literally pushed because it was a stampede of people, pushed my family into a storefront that happened to be open and ran to the back of the storefront and found a single occupancy bathroom. We ultimately hid 16 human bodies in a single occupancy bathroom. We put our children under our own bodies to help prevent them from getting shot. We turned off all the lights and we sat in silence for 2 hours and held hands with strangers in the community that we'd never met. We even at the very beginning, as adults, all said each other's names in case we were about to die so that we could die as friends. I'm the first to admit on that day that I saved no one. I did no great act as a physician. I didn't go back into town center to help anyone. I protected my children and myself. And once I made it out alive from that bathroom, I knew that the rest of my life would be devoted to preventing mass shootings and preventing gun violence. And since that day, I have spent every single moment that isn't in the clinic working on this.
Wow, Emily, hearing that brings me to tears. It's just devastating that this happened. And I just appreciate you sharing your first person account. I know this is deeply personal for you, but I think it's so important because it's fueled so much of the work that you do now. Can you tell me about how this has impacted your work as a pediatrician?
I think that I didn't recognize the power and platform that I had been given in this very tragic but unique perspective as not only a mass shooting survivor and a parent of young children who've just witnessed gun violence, but I'm also the pediatrician to many people in the community who either were affected that day, just being at the parade, being injured at the parade, or even just people in nearby communities who are afraid and have been made more aware of gun violence. And so now as a survivor and as a pediatrician, I have a very unique role in this country and a new platform for which I want to use to help people across the nation understand how serious this epidemic is and how much we can do to prevent future deaths.
Dr. Lieberman, I'd love to hear more about your shift into the advocacy world, how you began in this area, and what were some blind spots or things you found surprising as you were beginning this work and really immersing yourself in it.
So after leaving the bathroom alive, but forever changed, a couple days after the event, I jumped on a plane to DC and started asking legislators for change. That first experience in DC was shocking to me. In my mind, it seems so clear. Why would we let assault weapons, these weapons of war, in the hands of civilians? It seems like most of America is on board with not having them. 60 to 70% of Americans didn't want them either. But when I got to the Hill, all of a sudden it became very political. I would sit in rooms with parents who lost children or whose children survived and are the only remaining children from classrooms across the country, including Uvalde, and hear these horribly tragic stories, and I could barely breathe. It was so tragic. What the politicians did seem to find interesting was the analytical approach from a physician and the data that science has to support gun safety legislation. So I found my voice, I strengthened it, and I started collaborating with physicians across the country to work as an advocate. I started off very much focusing on the assault weapons ban. The assault weapons ban passed in the House for the first time in 30 years last summer. We worked tirelessly in 2022 to get the Senate to bring it to a vote, which they did not. That was my biggest disappointment. Starting January 1st, I moved from only covering the assault weapons ban to also working on other pieces of legislation that could really make an impact on saving children's lives. I decided to very closely advocate for a secure storage regulations bill and also for universal background checks. I have now had many fly-ins to DC with hundreds of advocates where we speak with lawmakers about these bills, both sides of the aisle, and try to come up with some middle ground that we can achieve to save children's lives.
Thanks for sharing that, Dr. Lieberman. I wanted to touch on the research piece of gun violence. I think it's really important as physicians and as parents that there are facts and there's research that has been done in this area that we can look at as not just opinion, but as fact and can help us in making decisions. There's been unique barriers to doing research in this area in the past. why is it not treated like any other disease that would be the number one killer of children, like cancer? Can you talk a little bit about the history of research in the gun violence area?
Yes, this is a very complicated question. A couple decades ago, as studies started being published that demonstrated a relationship that guns in the home could be dangerous, there was a push from the NRA to put some restrictions on gun violence research. The Dickey Amendment came to be, and that prohibited the CDC and later the NIH from funding any research on gun violence prevention. That led to a huge lapse in research. And one might ask, what does research do for this? Well, it allows us to figure out what type of mitigation strategies could help prevent gun violence. Without the research, we can't test always proper strategies. And to give you perspective, recently, and with special thanks to the Bipartisan Safer Communities Act, the CDC and NIH are able to start funding research in gun violence prevention, but are getting very little money. They get about $12.5 million each annually, which sounds like a lot of money. But given that it's the number one cause of death of children in this country, it is almost pennies compared to the billions of dollars that are given to other causes of death of children, including cancer, even HIV. All of these things are very important and deserve the money, don't get me wrong, but much more money needs to be spent on gun violence prevention research to help develop mitigation strategies.
The American Academy of Pediatrics has some recommendations on a general framework on ways that we can advocate for gun safety. Can you walk us through those and where the priority areas are and what kind of stands out in your mind as places that we as parents and people in the community can really focus on?
Absolutely. I think the first most important thing to understand is that studies do suggest that the safest home for children to grow up in is a home that does not have a gun. This is not political in any way. This is what evidence-based research demonstrates. That being said, there are many homes, millions of homes, in fact, across America that have guns. And knowing that it's an important part of cultures in many homes across the United States, we need to figure out how to safely store these guns. The American Academy of Pediatrics would recommend people store their guns locked, unloaded, with ammunition separately stored, also locked.
Okay, that's very helpful practical advice. What about if you're a parent who is sending your child to someone's home and you're not sure if they have guns and you want to ask about it? I know that can feel kind of funny sometimes. Like, how do you suggest that parents deal with the possibility of guns in their child's environment when it's outside of their home?
So this is a really important question, and I'm going to digress a little bit to explain this answer. It is estimated that there are about 30 million homes in the United States with children that have a gun. It is also estimated that about 4.6 million children live in a home where at least one gun is not securely stored. This is a problem on a very grand scale across the entire nation. The question of whether or not someone has a gun in their home is just as important as, do you have a car seat for my child if you're picking them up from school? Again, it's not a political question. This is a question of children's safety. I find in my practice that I have changed how I have framed this question in the past year and a half. I now ask every single parent at every single well visit if there are any guns in the home, and I tell every parent that the reason I'm asking is because I want to know if they're securely stored. That helps by normalizing the conversation to my patients. I then remind every parent that this is a very important question to ask before every single play date. I personally recommend that it is asked in a completely non-judgmental way. For example, if there are any firearms in your home, are they securely stored? And by that, I mean locked and unloaded with ammunition stored separately. I find that that very open-ended question is more palatable to all parties rather than, do you have a gun in your home? Because it suggests we just want to protect children.
That's a great way to ask it. And as a parent, that's something that I could borrow as my child is growing older and having play dates with other families.
And I found personally that even from parents who have guns in their home, parents who don't have guns in their home, they're all really grateful to start this conversation and to normalize this conversation. Many gun owners are very proud of responsible gun ownership. So they also agree that things should be stored securely and are very grateful to the idea that other homes would be doing the same thing as well.
And in that same vein, as a parent, how can you start this conversation with your own kids about gun safety? And how can that conversation change and evolve as the child ages and grows up a little bit?
I think it's really important that we're very honest with our children about the dangers of guns from a very, very young age. It's crazy to think this, but studies have suggested that children as young as 2 years old can pull a trigger. And we all know our children get into things that we don't want them to. As soon as you tell them no, that's the first thing they want. We have to teach them from the beginning that this is a very dangerous item that can kill. We must tell our children, if you see a gun, you run away immediately. You do not touch it. You find a trusted adult. You tell them about it and let them handle the situation. Because the truth is, many accidental injuries do occur when a gun isn't properly stored and children are being children and exploring.
I want to shift into discussion of one of the risks of having a gun in an environment. When we talk about gun deaths, we often talk about mass shootings or violence in a community, which we'll get to in a minute. But one of the biggest risks is suicide. Can you comment a little bit on how big of an issue this is? And are kids more likely to commit suicide if a firearm is in the home or if a firearm is accessible?
Yes, this is a massive issue in terms of the number of deaths of young children. I really think it's important to note that the number one cause of death of children in the United States since 2020 is firearms. So that's a staggering statistic. And suicide is actually a really large part of this number. And studies do suggest, without question, that the presence of a gun in the home, even if it is locked with ammunition stored separately, still result in a higher risk of completed suicide if that gun does exist in your home. So that's really important to know. It's also really important to know that firearms are the most lethal of all forms of suicide. About 23% of the time, people who use pills, for example, or other means, physicians are able to step in and use life-saving medical treatment and save them. On the other hand, if someone uses a gun to kill themselves, more than 90% of the time, they will die. Firearms are the most lethal means of suicide. And most of the time, we, no matter how expert our training is as physicians, cannot save you when a gun is used for suicide. So suicide becomes an extremely, extremely important part of this process, of this attempt to end gun violence and injury prevention. And finding ways to safely secure guns is one of the most important ways to help this.
Thanks for covering that. I want to move on to an area that I know brings chills down every parent's spine, and that is school shootings. They're on the news all the time. They're horrific to hear about. And a lot of times it can leave parents feeling helpless and worried. Can you tell us a little bit about school shootings, kind of like the history of them and what parents can do about it?
As parents, we do everything in our power to protect our children. We send them to school to get an education, to become productive members of society. And now our children go to school and have to learn active shooter drills instead of learning to read. That is frightening. And I would argue that most of our children, no matter how young they are also afraid of a school shooting and are very aware that this is something very possible. What's so striking is it can sometimes feel very far away, feel like your community is safe. We all live in our little bubbles. But I have grown to learn that no community is safe, and we never know what school is next. But we do know that they continue to occur. And many times each one are more horrific than the next. It's important for me to bring up here that when an assault weapons ban was in place between 1994 to 2004, there was a 70% decrease in mass shootings, and a great opportunity for us to help prevent school shootings and mass shootings would be to rally as an American public that we want an end to this mass shooting epidemic by supporting an assault weapons ban and a ban on large capacity magazines. That would not stop all mass shootings, but that would definitively decrease the death toll.
You talked a little bit about the impact on children and how children are really very aware of what's going on. I mean, they participate in these drills in schools. They see gun violence on the news. Can you talk a little bit about the emotional and mental health impacts of witnessing either firsthand, secondhand, or vicariously witnessing gun violence and the toll that takes on kids?
Absolutely. I think it's really important that we don't only use the death toll as the indicator of how serious a mass shooting was or an episode of gun violence was, because that's just the tip of the iceberg. Obviously, it's the most tragic part, but everyone witnessing these events has their life changed forever. And people who didn't bear witness but just heard about it or have a loved one that was affected are also never the same again. What we know based on scientific research and evidence is that once a child has witnessed gun violence or has lost a family member due to gun violence, they have increased incidence of mental illness. There's increased incidence of depression, anxiety, post-traumatic stress, suicidality, and actually, very frightening to hear, they have an increased risk of becoming a perpetrator themselves. So violence actually begets more violence. And we have got to put an end to this vicious cycle.
Absolutely. Can you talk a little bit about media coverage for gun violence? You know, I think one of the hardest things about this is that it's on the news all the time, and it's devastating to hear about. But I know that there are some disparities in what's covered in certain communities. Can you talk a little bit about that?
I think as Americans, we've become numb in many ways to gun violence. It's so frequent and penetrating all aspects of our life that many people try to look away. I do think it's a problem that the media focuses so much on mass shootings and doesn't always recognize all the everyday gun violence, because mass shootings only represent a very small portion of the deaths from gun violence. There are horrific health disparities occurring in our country, and brown and Black communities in particular are suffering everyday gun violence and many lives lost on a daily basis. And that does not get the same coverage as some of these other mass shootings. That being said, no life should be lost to something preventable. And there is a lot that we can do as an American people to demand legislation changes, to work on community improvement, to prevent these children's lives from being lost in such tragic ways.
Can you talk a little bit about how parents can advocate for stronger gun safety measures in their community to help protect all children?
The first steps is to understand that this is a public health crisis. And the solution here is not one answer. It's many answers. There's not one cure to gun violence, but there is legislation changes that can happen that would prevent gun violence, prevent the deaths of these children. The most important thing that every single person listening can do, no matter what state you're in, is to Google who are your senators and representatives and what pieces of legislation do they stand for? Are they co-sponsors of something like universal background checks to make sure that everybody who owns a gun is thoroughly checked to make sure that they are safe to be gun owners? Are they in favor of secure storage? Do they stand behind an assault weapons ban? If your legislator does support these things, then call and say, thank you. Thank you for supporting. How can we move these issues forward to protect our children? If your legislator does not support these things, then it's time to activate your community to tell them that this is what you care about as parents. You want to save the lives of your children. There's evidence and data that certain laws can save their lives. Rally as a community and demand that your legislator supports these types of actions that will save children's lives.
I know we've talked about a lot of really heavy things in this podcast, and that is by necessity because there's not a lot of light in this topic. But I think there are slivers of hope, and I'd like to just hear your account as someone who's been working so deeply in this area. What are the things that give you hope? Are there any signs that things are getting better? What's your outlook on this?
You're not wrong. This is a very grim topic to talk about, but I do remain very hopeful that as American people, we want better for our children. I know from personal experience that we took a very tragic event in our own home and we rewrote the narrative in our house. And it is no longer about surviving a mass shooting, but it's about saving lives and using our passion to do that. It would be my hope that all the parents at home who share the same fear of something terrible happening at their child's daycare or school or playground, that instead of being afraid, that you take action, that you activate your community, that you demand better from your legislators. And that changes the narrative to one of fear to that of hope for a better America for our children.
You've very much highlighted that this is a place where resiliency is important. What are some things that keep you resilient in this work?
The truth is, my children. Nothing is more important to me than my family. And I think that that's probably the case for all of our listeners. It's the fact that the day after we survived a mass shooting in a town that I would have considered Pleasantville, like I thought we were pretty safe up here, that next day I couldn't get my daughter on a camp bus. She was in a panic and crying and told me that she was afraid that someone was going to come for her at camp. And as a mother, I couldn't tell her nobody was coming. And I never had ever felt that loss of control before. I knew that I needed to gain back control. And the only way to gain some of this control back is to make change, to make legislative change. I look to my children and promise them that I am rewriting our story and I'm creating a better future for them. And I will do everything in my power to do that. And I hope that all the listeners can join me in that quest to create a better future.
It brings tears to my eyes to hear that. Dr. Lieberman, thank you so much for providing all of your insights and for all of the amazing work you're doing. To have someone like you at the forefront is just such a comfort and such an inspiration for the rest of us to also kind of step up and help in the effort. So thank you. And thanks for sharing all of this helpful information too.
Thank you so much. I hope it promotes change.
Thanks for listening to Kids Wellness Matters.
For more information on this episode and all things kids wellness, please visit luriechildren.org.